Hello, I'm Dr. Amit Bhushan Sharma, Director Head Cardiology, Paras Hospitals, Gurgaon. Today we're going to talk about what is heart attack and how do you identify the symptoms, and is chest pain the only symptom. So heart attack happens when there's a blockage in the heart and blockage in the heart arteries and the muscle dies. That is stage 3 or a heart attack, or in medical terminology that is called as a STEMI. ST elevation, myocardial infarction it is called. So that means the muscle is already damaged. Stage 2 is when there's a blockage but the heart muscle is not damaged. That is called as unstable angina. So typically the pain will be 1 or 2 kgs of weight in your chest. It will be diffuse. You will not be able to pinpoint where the pain is. If you are able to pinpoint a particular area, it is not cardiac. It is more like a acidity or gastritis. The pain may radiate to both the shoulders, may go to your neck, may go to your jaws, and you will have severe sweating. Sometimes diabetic patients or sometimes ladies or elderly population will not have classical angina. They will have something called as an angina equivalent. So angina equivalent could be shortness of breath, acidity, gastritis, or could be severe sweating, which is called as diaphoresis. So they will not have classical warning symptoms. If a diabetic patient is having acidity or gastritis, not relieved with ENO or with antacids, think it is heart. Diabetic patients after the age of 50 starts having a little shortness of breath on walking. It is not asthma. Asthma is a disease of adolescence. So diabetic patients with acidity or with shortness of breath is not acidity or asthma, because they will not be fatal, but heart attack definitely can kill you. So rule that out. Another thing, when you have a cardiac issue, what are the emergency medicines or home treatments you can keep in handy? First is 325 mg of chewable aspirin. If the patient is not in a position to chew, you dissolve it in a spoon and give it to him dissolved with water. Second is 4 tablets of clopidogrel, which is 75 mg each. And the third is 80 mg of atorvastatin or 40 mg of rosuvastatin. You will see it in the inbox once we are done with the talk. So these 3 medicines, aspirin alone will decrease your death rate by 22%, WHO guidelines. If all the 3 put together, this will decrease your death rate by 44%. So a loading dose in your pocket will save your life, your parents' life, your relatives' life. A 500 rupee note in your wallet or a credit card in your wallet may not be able to do that. So loading dose is very paramount importance if somebody is having these symptoms, or if somebody is having relatives who have a heart problem. A 325 mg dose of aspirin is hardly a dose. For a simple dose for a headache, we take 500 mg of Disprin. So 325 mg is a relatively harmless dose which can be given, which can be life-saving for such kind of patients. Now when you have a heart attack, the patient reaches the ER, then time is muscle, every minute counts, because you do not want the muscle to die. Because there is no medicine to revive a damaged muscle. Any cardiologist who invents a medicine to revive a damaged muscle will win a Nobel Prize. Right now it is not there, so time is muscle. There is something called as door to balloon time. The moment the patient enters the hospital to the time we put the balloon and open up the artery should be less than 60 minutes in such cases, so that the muscle which is damaged is minimized and the muscle can be revived once the artery is opened up. So we go essentially through the wrist and go inside and open up the blockages, wire it, balloon it, suck the clot and dilate it and create a stent and open the artery. Thank you.